President William Ruto has delivered a major address at the Kenya Health Summit 2026, held at the Kenyatta International Convention Centre in Nairobi. In his speech, the president addressed key issues surrounding Kenya's healthcare transformation, highlighting the government's plans, progress, and vision for improving healthcare services across the country. In this video, we bring you the full speech by President Ruto as he speaks to healthcare leaders, professionals, and stakeholders at this important national summit.
Distinguished guests, ladies and gentlemen, there are promises governments make because they are popular, others because they are convenient, and then there are promises a nation must keep because they speak to who we are and the country we intend to become. Universal health coverage is one such promise. For years, Kenya lived with a contradiction we should never have accepted, that access to health could depend on the size of a citizen's wallet. Illness could force a farmer to sell his livestock or sometimes his land. A mother could exhaust her savings, or a community forced to organize a fundraising simply to keep one of their own alive. Too often, treatment became a debt and sickness a pathway to poverty. That was wrong. It was also unjust. 16 years ago, through Article 43 of our Constitution, Kenyans made a solemn promise to one another. Through Article 43 of our Constitution, Kenyans made a solemn promise to one another. And that promise, the right to the highest attainable standard of health, was inscribed in our supreme law, and that no person shall be denied emergency medical treatment. That is not an aspiration. It is a constitutional. That command informed the promise we made when I sought your mandate in 2022. Universal health coverage was one of the 5 pillars of our bottom-up economic transformation agenda, because economic empowerment means little when illness can wipe out a family's savings or push citizens into poverty. Yet, by 2022, barely 1 in 4 Kenyans had health insurance, and fewer than 1 in 20 among the poorest households. Millions paid out of pocket, borrowed, sold assets, organized harambes, or simply stayed away from hospital because they could not afford. Kenyans were spending an estimated 150 billion out of pocket every year on healthcare. The problem went beyond financing. KEMSA's order fill rate had fallen to roughly 40%. Medicines were often unavailable, records remained paper-based, claims moved very slowly, and facilities struggled for resources, while emergency care remained fragments, moved very slowly, and facilities struggled for resources, while emergency care remained fragmented without a coordinated national response. We resolved to build that system from the bottom up, not to patch the old one, simply rename it or make another promise about it, but to fundamentally change it. On the 19th of October 2023, I signed 4 landmark laws that created the legal architecture for universal health coverage that replaced the NHIF Act. The Primary Healthcare Act strengthened preventive and community health care, while mainstreaming the place of our community health promoters. The Social Health Insurance Act replaced NHIF with SHA and established dedicated funds for primary health care, social health insurance, and emergency chronic and illness. The Digital Health Act established an integrated digital health system, and the Facilities Improvement Financing Act enabled public health facilities to retain and reinvest their revenues. Together, they transformed our healthcare in terms of financing, delivered and accounted for in Kenya, created the architecture through which we would finally translate Article 43 of our Constitution from a constitutional promise into everyday reality. We call this undertaking Taifa Care and connect families to facilities. More than 9 million households have been reached by our community health promoters, and over 750,000 people have been referred for treatment. For the first time, we have built a nationwide health network whose first point of contact is not necessarily a hospital bed, but the doorsteps of a Kenyan home. We are reversing the old logic of waiting for people to fall sick, finding hypertension before stroke, diabetes before complication, a high-risk pregnancy before the emergency, and disease before disaster. The national government continues to match county government contribution to CHP or community health promoter stipends shilling by shilling. From this level, when a patient requires further care, the next part of the journey begins. Through the Primary Healthcare Fund, eligible services at level 2 and 3 dispensaries and some level 4 health centers are financed by government. So far, the fund has received 27.4 billion shillings in budgetary allocation and disbursed 23.3 billion to support more than 20 million outpatient visits, benefiting over 15 million. As we said, walk in, receive treatment, walk out, just as we promised. And I want to commend facilities, both public and private and faith-based, for working with us on this endeavor. This is a fundamental shift. Prevent what we can, detect what we cannot prevent, treat early what we detect, and refer efficiently what requires specialized treatment. And when a Kenyan requires admission, surgery, or specialized treatment, the Social Health Insurance Fund provides the next level of protection, built on the principle that everyone should contribute according to their means and their ability, but no one should be denied care merely because they cannot afford it. That is why the government of Kenya has sponsored nearly 560,000 vulnerable households, covering approximately 2.2 million Kenyans, while Lipa Sha Pole Pole enables families in the informal economy to contribute progressively according to their circumstances and means. Today, circumstances and means. Today, 32.3 million Kenyans are registered with the Social Health Authority. 8 million have received treatment. More than 1.5 million mothers have been supported to deliver safely, and more than 500,000 surgical procedures have been supported and paid for. These are significant numbers, statistics, as some would say, but behind every number is a human being, an anxious patient, a worried parent, a frightened child, a health worker doing everything possible, and for a life to be restored or saved. Consider, for example, the case of Lydia, an 18-year-old student, and her mother, Naomi Mutendwa Kilunda. When Naomi's assistant chief encouraged her to register with SHA, she enrolled and listed her children as dependents, as is required. She could not have known then how much that decision would matter. Lydia later developed severe breast overgrowth that affected her mobility, her confidence, and her life as a teenage girl. She required specialized surgery at Kenyatta International Hospital, costing I hardly have afforded. But because Lydia was covered, her surgery was paid for, and so was her recovery. Today, she is back in school, preparing for her Form 4 examinations. Or consider Christine Awino Onyango, a 42-year-old widow from Kisumu County, diagnosed with stage 2 esophageal cancer. Until recently, Christine would have confronted two enormous burdens: the cost of highly specialized treatment on one hand, and the additional cost of traveling hundreds of kilometers to Nairobi to receive it. Instead, she received specialized care at Jaramogi Oginga Odinga Teaching and Referral Hospital, including surgery, intensive care, and post-operative management. Her medical bill exceeded 250,000, yet her annual SHA contribution was only 7,000. Her bill was paid by SHA. So, when people ask what happened to the bottom-up promise, to the mama mboga, the border guy, the farmer, and the ordinary working Kenyan, I say this to them. Look at Christine. Look at Lydia. And consider the millions of Kenyans who can now walk into a health facility and receive care. What could be more bottom-up than that? The transformation we have delivered. But the journey does not stop there. For some Kenyans, treatment is not a single visit or an admission or a procedure. Cancer, kidney disease, and other chronic and critical conditions can require care for months or years, with costs capable of overwhelming a family and their entire savings. That is where the next layer of protection comes in: the Emergency, Chronic, and Critical Illness Fund, established to ensure that prolonged or critical illness does not become a sentence to financial ruin. The same fund protects Kenyans when care cannot wait at all. In moments of emergency, when someone collapses, when a child cannot breathe, when there is an accident on our roads, or when a mother develops complications during a delivery, nobody has time to compare prices, search for telephone numbers, or negotiate deposits. That is why earlier this month, we launched the SHA 922 Lifeline and National Ambulance Dispatch Center. A free call connects a person in distress to emergency care, with evacuation and the first 24 hours of stabilization covered whether or not the patient is registered with SHA. No deposit, one office to another looking for money while a life hangs in a balance. And this is because Article 43 of our Constitution does not say emergency care is available only to those who can afford it. It says no person shall be denied emergency medical treatment, period. We are finally giving practical meaning to those words. Financing patients is only one side of universal health coverage. The other side is the facilities treating them, which must function. Through the Facilities Improvement Financing Act, public health facilities and all other facilities can retain and reinvest their revenues in medicines, equipment, and better patient care. Since October 2024, Social Health Authority has received more than 209 billion and paid out 178 billion to contracted facilities across 47 counties. KEMSA's fill rate has risen from approximately 40% to, as you have seen in the numbers there, 91%. That is commendable progress for KEMSA, but our destination still remains 100%. That is why we have extended a Kenya shillings 10 billion credit line to strengthen the supply chain in KEMSA. Ladies and gentlemen, digital health is the backbone that holds much of this architecture together. The old system was not only inefficient, but its opacity created opportunities for people to profit from its weaknesses. We had claims for procedures that never happened, fictitious patients who did not exist, inflated bills, and many more. We even encountered the absurdity of claims for the amputation of patients' legs several times, as though the same leg might have somehow grown. That was not healthcare, it was theft. And it was theft from sick people. That is why the Digital Health Act is so important. And you must have seen a huge campaign that was undertaken against the digitization of health. In fact, many from these schemes as to how expensive it was, how unworkable it was, and how it was assigned to some people, and that kind of thing. Digitization is not simply every patient visible, every treatment traceable, and every payment accountable. Let me repeat. Digitization is not simply about replacing paper with screens. It is about making every patient visible, every treatment traceable, and every payment accountable. That is what it does. And as I have said, this whole process, the heart of it is our digitization process. For the first time in independent Kenya, we have put in place a comprehensive legal framework, financial architecture, institutional framework, community and digital architecture for universal health coverage, built and sustained by the contribution of Kenyans themselves. We have crossed a historic threshold. Just imagine what we have done. You know, when we asked the people of Kenya that we need to change the contribution metrics so that instead of contributing a fixed amount, let us contribute a percentage of everybody's income. The difference is what you see. We have done so together, working hand in hand with the national government to make universal health coverage a reality across our country. And I say this with a lot of humility, that without the participation and the partnership of our county governments, this exercise would have been very difficult. And again, my good friends, the governors and the counties, I want to request you to stand up so that we can do a round of applause to all our counties. Thank you very much. You can take your seats. You were not so much interested in where the national government functions and the county government functions stopped or begun. Collectively, we were interested in the health of the people of Kenya. And that is why this partnership has given us this result. This is the partnership and the cooperation between our two levels of government that our Constitution envisaged. In our midst, we have also our members of parliament, who I very sincerely thank for debating and shaping and passing the laws that underpin this reform process, as was ably enumerated by the Speaker. Again, to our members of parliament, in both houses, we have members of parliament in our midst. Thank you very much. Thank you very much. We have both the chair of the Senate and the chair of the National Assembly in our midst. Asanteni sana. Please pass my regards, best wishes, and thanks to all the members of parliament who, across the aisle, debated these bills, made their contribution in formulating a sound legal framework upon which today we are undertaking this most consequential and transformational program in Kenya. Let me also, in the same spirit, thank my cabinet and principal secretaries. They have put in many hours under the leadership of the Deputy President to streamline and in a very consequential way made proposals on the improvements that were required, that were initially captured in our manifesto and progressively shaped into bills that went to Parliament. Again, Mr. Deputy President and my cabinet team and the principal secretaries behind you, simameni tuwapigie makofi. You guys have done a wonderful job. Asanteni sana. I really appreciate your support. But crossing this threshold does not mean the work is finished. It means Kenya should pursue universal health coverage. That we have crossed that Rubicon. But how we make it work even better for every patient, at every facility, and in every county. That is the task ahead of us now. And we must be candid. We know that there are areas to improve, including making registration easier, benefits to be made clearer, claims faster, digital systems more seamless, and the quality of care more consistent. Because the ultimate measure of reform is not the laws we pass or the numbers we register, but the experience of every patient in terms of dependable, affordable, and dignified care. That is the measure. And we all know reform is not an event. It is a continuous journey of closing the distance between the promise we made and the experience of every Kenyan who seeks care in all our facilities. Ladies and gentlemen, this summit also comes as we begin a wider national conversation on the Kenya we intend to build beyond Vision 2030. Your contributions over the next 2 days, coverage today, they will help define the healthcare Kenya should guarantee to its people beyond 2030. Serious nations do not start again every 5 years. Governments will change, but a Kenyan's right to health cannot change with them. We can improve what we inherit and correct what does not work, but we cannot tear down progress without an answer for what comes next. Universal health care must become part of our national covenant, not an achievement of a government, a party, or a president, but of the people and of the Republic. That is why the National Development Charter matters, so that our children begin where we finish, not where we began. We have come so far, and we have further to go. Let us use these 2 days to strengthen what we have built, improve what can work better, and safeguard for generations what Kenyans themselves have made possible. I want to thank all the participants. I am looking forward with great anticipation for the next 2 days, so that we can do a stock take of what we have achieved, agree on areas that need improvement, and consolidate